I've seen that video now a number of times, and I have to admit that even now, while watching it in its entirety like that, I'm just blown away by how inspiring these people are. If we do indeed have a culture of accessibility at Carleton, it's because of people like Angel, Daryl, Amanda, Sam, Jenna, and Fenyo, who have paved the way and continue to pave the way for it. From the bottom of our hearts, thank you all for sharing your stories with us and being for the inspiration for Love Made Visible. I'd also like to take a moment to thank the production team who made this possible. Larry, Michael, and Jocelyn from the PMC, and Hazy, Greg, Kaya, Lisa, Marissa, and Ty from Teaching and Learning Services Media Production Center. Thank you all very much. I'm now going to turn over the proceedings to my colleague, Amanda Blais, who is the Senior Disability Learning Support Coordinator in the PMC, and also one of my favorite Toronto Maple Leafs fans. And I never actually thought I would string all those words together in one sentence, but Amanda, for you, I did. A Carleton University alumna, Amanda has worked at the Paul Minton Center for Students with Disabilities for 10 years as a disabilities coordinator and learning strategist. In 2018-2019, Amanda led a team in creating and implementing the Carleton University Accessible Experiential Learning Project, now Act to Employ, providing subsidized employment opportunities for students with disabilities. And I have to say, Act to Employ is one of my favorite programs here at Carleton. I always get a bit of a kick because when I'm talking to colleagues at other institutions, I talk about Act to Employ and it usually just blows their minds. It is what I like to refer to as an absolute rock star program run by some very, very special sort of rock star people, including our own Jenna Lambert from the video. And Amanda, you were there at the very start of it.
I can say I was there at the beginning. Thank you so much, Bruce, for that introduction. I too never thought that you would call me your favorite Leafs fan. I didn't know you had one, but I'm happy to be the one.
I said one of, I think.
One of, right. I have the honor or privilege today of hosting the phenomenal panel who will be speaking to us about accessibility and how it's been represented at Carleton, what we foresee will happen in the future. And I'm just really excited to jump into our panelists because although the video did an amazing job of highlighting a lot of lived experience for students who have gone through PMC, it's great to, as the students in the video mentioned, hear from other folks in the community, persons in places of power with represent the disability community, as well as we have former graduates as well. So I am going to introduce our panelists, and I'm going to start with Dr. Tammy Ricci. Dr. Ricci earned her PhD in clinical psychology from York University in Toronto, her master's from Carleton University, and an honors BA from Nipissing University. She is trained in a variety of clinical settings, including CAMH, formerly known as the Clark Institute of Psychiatry in Toronto, the Chiropractic College in Toronto, the Counseling and Development Center, York University in Toronto, and the Downsview Rehabilitation Center in Toronto. So Tammy's doing a lot over there in Toronto. In the past, Dr. Ricci has worked at the Paul Minton Center at Carleton University and at the Rehabilitation Center in Ottawa. She has been in private practice for the last 22 years. I never would have guessed that, just talking to Tammy, and is registered member of the College of Psychologists of Ontario, as well as a member of the American Psychological Association, the Canadian Psychological Association, the Ontario Psychological Association, the Canadian Academy of Psychologists and Disability Awareness, the Canadian Society of Medical Evaluators, the Ottawa Academy of Psychology, and the Canadian Registry of Healthcare Providers. Currently, Dr. Ricci lives in Ottawa with her husband and 2 teenage sons. So thank you, Tammy, for being here. I'd also like to introduce Dr. Paul Peters. Dr. Peters has a PhD in sociology from the University of Texas at Austin. He is an associate professor in the Department of Health Sciences at Carleton University and leads the Spatial Determinants of Health Labs. Dr. Peters was late diagnosed with ADHD and has a proudly neurodiverse family. Probably diverse as well. Since his diagnosis, Dr. Peters has worked to promote accessibility by sharing his experience and amplifying those of others. He is active on ADHD Twitter as @UNITEPANGAEL. Dr. Peters' academic research aligns with the values of accessibility via the study of small spaces and small places and small spaces, sorry, my tongue is being twisted around, in a context of enduring social inequities. These health inequities are manifest between social groups across a range of factors, such as income, education, or ethnicity. At the same time, health inequities are spatially evident with differences between provinces, regions, communities, and neighborhoods. His lab has received funding from the SSHRC, the CIHR to study rural health, small area rate variation in hospital use, and the environmental factors associated with autism, ADHD, and OCD. Thank you, Paul, for being here as well. And I'd also like to introduce Rebecca Andre. Rebecca is a recent graduate from the Applied Linguistics and Discourse Studies BA Honors Program at Carleton University with a minor in Disability Studies. Rebecca is a passionate disability rights advocate with a firm belief in the power of language and its ability to give dignity back to those who have had it stripped away. Rebecca believes that creating spaces at the table for voices of those with living experience is a vital step towards the cultivating change and building a society we can be proud of. Andre has worked with Carleton's READ initiative on critically important projects that help move our community towards creating more inclusive spaces for persons with disabilities and is excited to be able to continue this work. Rebecca identifies as a disabled woman living with both visible and invisible disabilities and continues to make the commitment to learn, to educate, and to consistently push towards a more inclusive community for everyone. And to round out our panel, we have Larry McCloskey, who needs no introduction because Bruce already gave it to us earlier. So, but just as a reminder, Larry has been around since the ice melted, I think is the end of the bio for Larry here. So I'd like to get us kicked off. And again, thank you to all of our panelists for joining us today. Before we begin, please be sure to use the comments to also include your questions as we go along, as we will be allowing a question and answer period at the end. Anything that is not addressed, we will also have answers for and publish after the event as well. So let's get going. So Tammy, in your experience, what has set Carleton apart in the area of accessibility in the past 30 years?
It's a big question. And I just want to quick comment. I did work at the Paul Menton Center very briefly as a receptionist, and I really sucked at it. So sorry if anybody was there at the time. Messages may have gotten lost. Yeah, so I think for me, it's not one thing that sets Carleton apart, but rather an attitude, a commitment to improve the lives of people with disabilities. So when a need is brought forth, you know, I've gone to other universities. It's like, well, think about it. I don't know. It's too hard. But at Carleton, it's like, okay, let's figure out how we can do this. And I think that, you know, embodies what they've done over the last 30 years. So they create possibilities with a focus on ability rather than disability and really removal of barriers, right? And for me, my time at Carleton, a while back, it was about, you know, I felt like I was a person and I forgot at times that I was disabled because those barriers were removed, because I could be a person living in residence and hanging out and getting drunk and even having a hangover. And all the supports that were there allowed me to be, you know, the person that I really was rather than the disability. And it was life altering actually for me. I mean, I met my husband there. I understood that there were all kinds of things that were possible for me, including a PhD program, including children, all kinds of things. So I think, you know, going back, I think it's attitude and commitment for me. Yeah.
Thank you so much, Dr. Ricci. Attitude and commitment is extremely important. And I feel like Larry's going to have some more to highlight there in terms of what's happened over the past 30 years, as I think you've been here the entire time, eh, Larry? So I'll turn it over to you.
Thanks, Amanda. By the way, Tammy is a real superstar in life and certainly was at Carleton and as associated with PMC. When you just reading her credentials and her associations was quite amazing. It makes me almost wish I'd finished grade 12. Actually, I'm kind of embarrassed, but so yes, things go back a long way and things have really changed. And what we did well, I think, started with having values and doing what we said we were going to do, developing good practices, which resulted in good outcomes. So, you know, the cornerstone here, though, are the values and following through, and then also our regard for the student as a complete person, I think was really, really pivotal. So emphasis on relationships is what I'm always going to come back to. That also spills over into PMC in terms of staffing. So I think that people had a very good working relationship, and that, of course, is still true, which translates, though, into what is given out and shared with students. So one really important difference, I think, in terms of other places was we were confronted with really intractable, seemingly intractable problems around accessibility and all kinds of things. And so what we didn't do was avoid. We embraced the big problems, even though it was difficult and there was always fear of human rights. And we were less concerned about human rights cases than just sort of not following through properly for students. But we embraced those things. And really, we didn't anticipate this, but over time, that started to garnish us a reputation that we were actually surprised when we got the feedback about that. And just sort of one example was around learning disabilities. I was involved in the Learning Opportunities Task Force for Learning Disabilities, and Betty Stevenson, the former cabinet minister of many portfolios, called and said she's getting all this sort of good, all these students saying good things about Carleton, and so she wanted me involved on the basis of those students who were such amazing ambassadors. So as well, we didn't capitulate to the tyranny of low expectations. We knew our students could do what any other student could do, and they followed through, and under difficult circumstances, I might add. One thing too that we did is we met faculty, I think, to some extent on their own terms. Back in, I remember in the 90s, there was a lot of friction between our office and faculty, and often people in our positions would use the Human Rights Code and as sometimes a bit of a weapon. And it's what we did was to try to engage and to take into consideration their part of the equation and to deal with resistance in a way that could, often in an empirical way. Just to give you an example, I remember the Dean of Engineering and many engineers had a meeting and I had to come all by my lonesome. So I had redacted a psychoed assessment to show that it was done with empirical testing done by a peer PhD clinical psychologist. And that won them over because of the empirical side of things, and they could see it. But as well, we made some adjustments based on what their input was. So that was the type of thing too. We didn't see relationships just as with students, the most important, not just with staff, next important, but also with faculty, very, very important. And that to get that trust over the years, I think was really, really important. So that continues. Thanks.
I can certainly agree that having the whole, as Jenna said in the video, the whole village around to support and ensure that students' needs are being considered before they're needed is always a good place to start. And I would like to kind of go off that a little bit because, again, I know that as much work has been done in the past 30 years, there's always room for change and there's always room for growth. So Paul, in your opinion, what does Carleton need to do in order to remain a leader in accessibility?
Thanks. I think Carleton is a leader in accessibility. I think that's one of the, obviously we know this. I think the overall understanding of disabilities changing in sort of broader society. And I think that's good. because I think a lot of that needs to do, and I think Carleton proclaiming itself as a leader and challenging others to step up as well is a big step, and getting this to become, across the country and across academia, because ableism in academics is alive and well, and dealing with this, requires it at all levels. One of the things is sort of my bio. I'm late diagnosed ADHD, and one of the reasons why I've become out vocal about sort of the difficulties that I've struggled with anxiety, depression, improper coping mechanisms, and things like that, is so that people can see people throughout the community, and have that promoted, so that we see that there are people at all levels and everywhere within academia, with disabilities, of various degrees, various types. And so I see that as one of that. Also, I think that the Carleton could increase the normality of accessibility, and that people talk about accessibility or advocacy exhaustion, becoming exhausted with advocating for oneself, not just every term, but also in every course, but also in every assignment. And then along with that, disclosing and barriers of disclosing and diagnoses. And these all become barriers and issues. And I think that increasing the normality of it, and Carleton's gone a long way, but I think it does need to move beyond just where it is right now, sort of throughout teaching, learning, and also beyond that to seeing the whole person within academics, but then within their whole environment, and knowing that people's disabilities and challenges don't stop at the university gates, right? They're at home, they're elsewhere, they're in the community, they're in society, and seeing people throughout that, and then throughout their journey, that those are faced elsewhere, and those can impact their ability to succeed in academics, their ability to thrive.
Thank you, Paul. Again, another insightful look into, again, not just students, but also faculty and staff and everyone that is connected in the community, and really trying to foster that awareness and growth. Now I'll turn it over to Rebecca to see if she's got any insights into, how can we remain leaders of accessibility?
Yeah, thanks. I just want to sort of riff off of something Paul just said towards the end. It's like that accessibility or support stuff, it doesn't just stop at academics. It doesn't stop in within university. I think that's something that Carleton does really well with the Act to Employ program, or when it started with CUEL. It's like there's still so many people with disabilities that are underemployed. We're overeducated and underemployed. And so, we're working through these programs like Act to Employ. We're working through there to like sort of bridge that gap and give us the experience, and giving us the experience not only to get experience for our resume, but also learning how to advocate for ourselves, learning how to have those hard conversations with employers, learning how to manipulate the environments, learning how to ask for accommodations, and knowing that someone has your back no matter how difficult that conversation is. That's actually really important. And I think that's one of the most beneficial things that I got through both the CUEL program, because I was there at the beginning too, and the Act to Employ program. Those were really important things for me to have, even as a mature student. So that was great. But also one of the things that I wanted to put on the table is that we're at this pivotal point now where everyone is starting to question. And it's a really important point in our like tipping point, our ladders, that everyone has been talking about accessibility now. The government's been talking about accessibility, but now people are starting to question, okay, but what is accessibility? What are accommodations? And I think we need to create more spaces to have those conversations. And that's how we can continue to put this forward and create an even more inclusive environment. Thanks.
Forever the rock star. Yes, we do need to work towards defining what accessibility and inclusion looks like, as it's been probably defined by other people as it tends to have happen. So, and it can mean different things to different people. But as a university, what does it mean to us, and how can we move it forward? Larry, do you have any final thoughts regarding this question in terms of how do we continue to remain leaders in accessibility?
Well, a really prevailing but kind of simple sounding mantra for the past, which applies to the future, has always been for us, keeping it real towards getting it done. So I think that universities do have a slight tendency sometimes to be a little more aspirational than practical. So I think being mindful of that, because this is an area where we really need to do what there's practical things that need to go alongside the more theoretical approach for which universities are renowned. So both are good. We have to do both. Interesting though, on the question of defining accessibility and disability services and so on, here's an important point that I really wanted to make for this question. One thing we learned, and FIDA actually was informed by what we learned on learning disabilities, PMC, then FIDA, then it's come back to PMC, because PMC does a lot more than accommodation, a lot of the student development learning skills. And we know that that's really important. It's not all about accommodation. Now, the interesting thing about FIDA is these are students with poor mental health without diagnoses, and most of whom do not get accommodations, but they get all kinds of other services. So one of the things that I think is important moving forward is, and sort of building on what the two previous people have said, is that I think we need the mandate where we have definition and documentation. But for this emerging population of poor mental health, we don't necessarily need to have them qualified by a PMC definition, but we have to serve their needs. We can do that, and we don't get caught up, and we don't limit. We can, because this percentage of students with poor mental health is going to get bigger and bigger. And so I think that if we can do away with some of the bureaucracy and qualifications up front, we can serve students better on the other end of things. The interesting point of maturation for me, from the past to the future and moving forward, is there are things we have learned at not just PMC, Make the Cut, FEDA, and the Attendant Service Program, and all kinds of things. And read. We are now learning things to include persons with disabilities, but many of the things apply to all students, to the general population. What we learned on the student development side is that this is what students need. We happen to have applied it to students with disabilities and to students with poor mental health. That piece has not caught on to the extent possible. And to me, that's the most gratifying thing, apart from working with people like you, Amanda, and students. But in terms of what we accomplished, the most important thing was this piece of not only getting to a point where we had a better idea and better practices with better outcomes, but now we can apply these to the general population if they're interested. That to me is where you go from this sort of outlier service to something that is fully integrated into the entire university.
Thank you, Larry. And I have to agree, I do feel like the more that, and again, it was said over and over again in the video, the more that students and really anybody in the community can raise their voices and be included without having to necessarily have the documentation there, can really help to further things along and make it a more inclusive environment. Rebecca, you'll have to define what inclusive means for everyone. Now, I'm mindful, Tammy, that you have to be going soon, so I'm going to target this one to you first. And today being the International Day for Persons with Disabilities, I wonder how many of you, those watching, caught on to why we were hosting this today. What does the International Day for Persons with Disabilities mean to you, Tammy?
Yeah, I think it's a time to reflect, right? A time to reflect on the past, what's been done, mistakes made, the good, the bad, and also look, across cultures, across countries, right? And learn from each other. You know, I think that we can kind of, you know, Carleton as an example. I mean, really, Carleton has been at the forefront, even in terms of their attendant services program. It's, you know, world renowned, right? And I think learning from things that have already been conducted, right? Rather than reinvent the wheel. But also kind of taking a look ahead. What needs to be done? Where do we need to grow? What do we need to do? And part of that is looking at how do we eliminate or reduce barriers and really focus on ability. And I like what Larry was saying about, you know, it's not necessarily having a diagnosis or a label put on someone, but it's really working on what are the issues for that person, what are some of the barriers, and how can we assist them to overcome those barriers. Maybe not eliminate, but overcome.
I love that. So looking at, like you were saying, the abilities of people and you know, making sure that those barriers aren't existing. Thank you so much, Tammy, for joining us today. In case you don't get a chance to say that, I know you have to jump off, as you have wonderful clients that are awaiting your support. So thanks again for being here. In case we don't get to come back to you,
Well, thank you for having me.
I'm going to turn this question over to Paul. So Paul, what does the International Day for Persons with Disabilities mean to you?
Sort of building on what I was talking about before is you know, what disabilities look like. You know, as being late diagnosed ADHD, and someone who has at that point had a PhD, 3 kids, had been a research chair, you know, how would this apply to me? You know, I didn't know, these were all unknown. Would those have benefited me as a student in the general undiagnosed population? Yeah. Could they have helped me understand that better earlier? Probably. But I think also it gives us a chance to sort of reflect on, you know, what does disability mean? And in this term, sort of moving beyond, I think one thing that it can help is highlighting the need to move beyond just talking about accessibility and access, and then asking questions sort of like, well, what about thriving? Right? Let's help people thrive. What about flourishing? Right? These are what we need to work towards. Our bar isn't accessibility, right? Our bar is flourishing and thriving. And I think that's where I think we need to set our bar at, beyond that. So, and part of that is with the International Day for Disabilities, I think is what they highlight is that it's not the lack of adaptation that's the root of the barriers, right? So it's not that we don't have these accommodation that's the barrier. It is the lack of accommodation that's the barrier, right? The lack of adaptation of the system. It's not the individual with those barriers that we need to focus on. So it's moving beyond that. And I think the International Day for Disabilities helps us do that, that we see that it's the lack of adaptation in the system. And the pandemic has really helped illustrate a lot of those things. You know, I knew of instances before the pandemic where people couldn't finish their degrees because there was a requirement for being in-person classes for certain colleges for certifications. So they actually had to be in person. So for those with disabilities, if they could make it to classes, then they wouldn't be able to get their degree because they couldn't get credit for it. Well, the pandemic turns all this on its head completely. And we realize just how nonsensical that is. And there's lots of these things that are in a way nonsensical that we just haven't seen yet. And so, you know, in the one hand, you know, things may become more invisible with the pandemic, that things can hide, but in a way it's also shown us a lot of things that, you know, are there to address and are there to help.
I love that. It's not, the accessibility isn't the bar. It's, you know, how do we allow people to thrive, right? And I love that visual, everything that happened there. It also probably, to your point with regards to online learning, it probably explains potentially why we had more graduates this year than any year previous to Carleton, right? There was a lot of people who were able to come back and take courses. I mean, speculation on my part, but I'd be willing to guess, Paul, that might be maybe what it's related to as well as access. Rebecca, do you have any final thoughts for us on what the Day for International Persons with Disabilities means to you?
Yeah, I do. So I'm just going to toss out something that I pulled from actually Sam in the video, that progress is slow, but it's also constant. And that just sort of hit me like, this is just sort of what we're doing. We're just progressing slowly, but at least we're progressing. But what the International Day of Persons with Disabilities, what it means to me is it's the day that we were acknowledged that we were people. And if we can reflect on that and think that this day was acknowledged in 1992, and it took that long for them to acknowledge that we were people too. And I think that's a really hard and important thought to keep with us as we go forward.
I will give people a moment to kind of consider what you just said, Rebecca, because I think it's extremely important that the recognize of persons with disabilities was so recent as being recognized as a person. So thank you to all of you for answering those questions. And I'm done asking questions on behalf of us, and we're going to turn it over to questions from the audience. So I'll open it up to our three panelists that are remaining. So are there, with the recent trends, sorry, let me start this over. Are recent trends in increasing numbers of students with non-visible disabilities changing the way disability services do their work?
Yes, it is. And of course, the disability offices have all this pressure now to include everyone on the basis of this documentation and the diagnoses thing. So that was my point. And yes, we've talked about this and over the years. And so partly the pressure is then in trying to be inclusive and trying to do a good thing is to lower the standard. So what we have said and maintained and have done is tried to actually, instead of, why do we insist on students who need help, really need help, but may not have to get a diagnosis to get it? They don't necessarily have to fit the DSO. And we did this other thing called FITA in order to do that. But then we created a hybrid within PMC where we have students and they have a diagnosis, and we do this other piece in terms of the student development, because there is a limit to accommodations as, and this is what we're seeing throughout the province. Accommodations are always going to be needed and they are absolutely necessary. But we do have a trend coming from high schools where students come and they have increasing numbers of accommodations. And we find out sometimes in the schools they're in, they're getting a cookie cutter approach, time and separate space, but they don't know really why. And so they're not really as informed as previous students. And we have asked and been told that really it's easier to administer if they just do a cookie cutter approach. So for whatever we do, increasing numbers though is not an excuse to not get at the specific needs of individuals, because otherwise a student who has 2 accommodation needs and has 12 that they think they need is being burdened. So it really is important to do this work. The numbers are going to continue to increase. And I do think though that the big thing to watch is going to be poor mental health. It's going to be a big percentage. It'll surpass, I think, all of the DSO numbers. So somehow to structure that so that DSOs are not under all this pressure, because we don't want to turn students away. And if they can't meet a criteria and they still need help, it's a structural problem. And I think that it's something that DSOs can work with, and PMC is doing a marvelous job.
Thank you, Larry. I have a feeling this is going to come back to you. So this could be a rather quick one. It's coming from Maria. She's asking, I wonder, is there any consideration for changing the name of the Paul Menton Center for Students with Disabilities to something like Paul Menton Center for Accessibility, or Paul Menton Center, or Paul Menton Center for Thriving Communities? AKA, is there room for change when it comes to how the PMC is known?
Well, who should answer that? Because I'm not there.
That's a great question. Again, I feel like you probably are the most knowledgeable as to how that could happen.
Okay, so this has come up before, and we never said, well, we're not going to make a change. We just hadn't decided. And one of the changes that did happen, though, that was some centers were actually narrowing in terms of their name, which also coincided with their services, to call themselves the Accessibility Center. That we didn't believe in, because we have this, and Amanda, who is this host at this point, has been pivotal in terms of the student development work, which is a leading contributor to student success. Whether or not students have disabilities or poor mental health, it's really important. So it could happen, and I don't remember anyone being resistant to, but I'm not really sure. You know, I don't know. There are many things I don't know, and this is one of them.
It definitely was a tough question to ask there, because again, Paul Menton Center is you know, a big branding name. A lot of what's happened in accessibility has happened as a result of that. Thanks to Kathy for pointing that out as well, who you'll be hearing from shortly. We have another question coming out, which is, knowing that the community is very diverse and people with disabilities have many ways they identify, how can we continue to assure that people are not having to choose between their identities in order to get accessible and disability confident services, supports, and spaces? Who would like to tackle this one first? Rebecca has her hand up.
I think that we've done a pretty good job right now so far, the things that we've done at creating spaces where you don't have to separate who you are in this field of flowers. I think that with the people that we have on board right now, they're all pretty great at acknowledging that no disability or impairment or any of that, nothing looks the same. Everyone has their own journey. Everyone has their own walk or movement or journey forward. And it is what it is. And I think that there is so much space for everyone's identity to exist, even within the place where, even within Reed, I use identity first language. There are some who use person first language, and we were always able to just exist. This is how we are, and everyone has their own. So I think we could exist together.
Thank you so much, Rebecca. Paul or Larry, do you have anything else to add to that question? Let me know if you need me to repeat it. Okay, we'll move on because we do have lots rolling in here. So thank you for your heartfelt and moving reflections. There are variations in accessibility for learners across campus. For example, lab-based activities have many accessibility challenges, as does field work. What can Carleton do to improve lab-related accessibility in the sciences, engineering, field work, geography, etc.? Thank you. Paul, go ahead. Yeah, I was like, I hope Paul wants to answer this question.
Number one, having these conversations, and I know that I'm in the Faculty of Science, and I know that we're really having these conversations. I was really heartened when we had a session for faculty and staff recently, and the number of faculty that showed up to talk about it, and to talk about some of these questions and realize where we're not addressing them, because it does go across a wide range. With field work, lab-based activities, and there are a lot of things. So having those conversations about where one might have those barriers, and then for those of us, you know, who are faculty, to normalize these things within our work. So it's not an abnormal thing for accommodation, but it's part of normality. So that they're there and they exist, and it's not up to the individual to always request and look for it. Some of the barriers we do face in some aspects of science include financial, because a lot of research is paid for outside, and we need to address as researchers, we need to advocate for that, so that this doesn't continue to become a barrier to us in our own research funding grants, to allow for any additional, you know, financial costs that come about because of it, and to allow things to go on. But I think making it clear, you know, across these different areas, and also then changing the culture within that you know, and I think that part's been really slow to change within laboratory based, and I talk about that with the work that I do on computers and then in field work as well. It's been really slow to change and sort of seeing the barriers for doing that. But I think that I see that as one of the next steps in allowing for that to happen at those levels too.
Amanda, it's also worth noting, this is actually an issue that SOMI has looked into over years, SOMI Tam, but as well, Matthew Cole and Dean Melway are heading up a full campus audit that is huge, and Carleton will be the only university in the world to have done that, and that will include the accessibility of physical labs. It's expensive work, needs to get done. One thing that has happened, some people have noted over the years, as the percentage of people with non-visible disabilities has gone from about 10% to 90%. And there's been inclusion of groups that were not included in previous decades. But some of the work around physical accessibility, I think, did not get done as a result of refocusing towards these other groups. So legitimate reason for moving, but no really excuse for us not to get the physical accessibility right. And so that does need to be addressed though.
I know that PMC and Reed continue to work with various faculties and departments to, again, really raise awareness to how can we make these environments more inclusive. So although we want to have the student voices a part of the discussion, and we constantly encourage that to happen, we're also, again, thinking from the design perspective of, okay, so how can we make this happen so this isn't something that is necessary. So we are having those discussions with a lot of faculty as well. But as Paul said, discussions like this need to happen in order for change to continue to occur. There is a question in here about how someone can facilitate shifting the mindset on what accessibility means. And I have a feeling that Kath will be talking to us about CAS in her presentation, or give us some idea of things that are happening on campus. So I do want to move to our last two questions. One is, I'm interested in how we can partner with public and private businesses to demystify process and pathways for better workplace participation and inclusion. And we see it a lot. I mean, through Act to Employ, which has been mentioned several times, Career Services is doing a great job with Act to Employ to ensure that that continues to happen for students in their placements and co-op, on jobs on campus and jobs in the community. But opening it up to Rebecca, Paul, or Larry, how can we partner with public and private businesses to demystify the process? I think that kind of opened up the door for that. I think DCOI did that as well. And Rebecca, you work for DCOI, so maybe you could speak to that a little bit.
We had a lot of fun. I'm going to say fun because I did a lot of the event planning with Moira, which was so much fun. But it was really great to see how the students, so what we did, if people aren't aware, is we hosted career network events. And so we hosted them for the partners. So like Ottawa, the U Ottawa, and et cetera, et cetera. And so we went, the one at Carleton was great. And it was so fun to see the students that I knew from like our community to go through, and like just the way that they held themselves, they were so confident and moved through the room, and they sat at a table and they had these connections. But it wasn't just the whole event, it was the back end that happened, where there were communications with these partners, these people that came and were ready, willing, and able to hire students with disabilities, and the conversations that were held about what are accommodations, what kind of accommodations do you have for hiring processes, what kind of, what does it look like when you bring in students with disabilities into your workforce, and all kinds of things like that. So that was really good. And DCOI did a whole bunch of other stuff, but I'm sensing we're running out of time, so I'll just cut it there.
No problem. I was going to thank you so much, Rebecca. And again, if people have more questions about how we partner with public and private businesses, again, you can reach out to us. You can PMC. You can reach out to Career Services through Act to Employ. So again, lots of ways to do that. And I'm going to finalize our last question before I turn it back over to Bruce, to Larry. And Somi is asking, what is your advice for Carleton to maintain its reputation and leadership in accessibility?
Well, I should, first thing, I read an article recently about how bad predictions tend to be, even by, or especially the experts. So everything has to be taken with a grain of salt. But You know, I mean, for me, it has to do with the application of what worked in the past towards the future. So, and most of all, with technology and with all the great tools that are being developed, and these are really important. And we've seen with the teleconferencing that gave a certain, we learned advantage towards people with disabilities and so on. But we have to keep things real, and we have to focus on the individuals. And I'm going to relate this question to the previous one too. People like, you know, the Sam Grahams, Tammy Ricci's, Jenny Lambert, they need to be front and center for people to see what people like this can do in the work world. So I do think that we have a culture of accessibility, and I think that we can grow it. But I think that the best thing is to rely on our people doing good things out in the world. And but again, though, this sort of down to keeping it down to earth in terms of where the accomplishments lie. We don't track, actually. No, PMC's never had, and I certainly wasn't doing it, kept track of some individuals. But it would be great to have in there, in people's spare time, tracking all our graduates and building on that thing. So anyway, I come down on the human side, and only slightly because I'm a bit of known as a bit of a Luddite, but yeah. And Somi is actually one of those people who will do some of the best work with on the human side of things.
Couldn't agree more, Larry. And thank you to all of our panelists today for being so open and honest and informative about accessibility practices here and how we continue. And I am going to turn it over to Bruce before we break for today. So thank you again to the three of you and Tammy.
Thank you very much, everyone. And to Larry's point, you know, one of the things that I've always marveled at is how much richer the PMC is because of work that students do with us. And we have one of the largest volunteer programs on campus, if not the largest. Prior to COVID, you know, we had about 1,700 volunteers. Just the sheer talent from students in helping us with our programming, I think is one of the reasons why PMC has been considered the gold standard for disability services. And by all means, there's absolutely no doubt that when people graduate, that talent is firmly being displayed in the workforce as well. So I agree, Larry. I think that's something that we need to work on moving forward. With that said, a big thank you to all of our participants. Dr. Tammy Ricci, Dr. Paul Peters, Rebecca Andre, and our own friend, mentor, and guest of honor, Larry McCloskey. Thank you very much, all of you, for sharing your insights. It's been wonderful. We are doing well for time, so we're now going to take a 5-minute break. And when we come back, Kathy Malcolm Edwards will share with us about Carleton's coordinated accessibility strategy. So you don't want to miss that. Thanks.